Okay, so the topic for this lecture is emerging and re-emerging disease. The lecture outlines include the description of emerging and re-emerging diseases, the factors contributing to emergence, and the preventive measures for the emergence of these diseases. So, the world stands on brink of global crisis in infectious diseases. We see uh, a large number of diseases that are increasingly being reported that are responsible for high number of mortalities and morbidities worldwide. And the threat of these diseases cannot be ignored any longer. We saw during the COVID pandemic resulted in millions of casualties and overburdening our healthcare systems, and which resulted in total collapse. So there are tremendous consequences for well-being of individuals. And this is also due to the development of resistance to antibiotic drugs. So emerging infectious diseases are those whose incidence in humans have increased during the last 2 decades or which threaten to increase in near future. It also refers to newly emerging infectious diseases. The mode of transmission include direct or indirect, either from person to person, by insects or animals. So this is a disease list. This is a comprehensive disease list which have been reported since 1973. Include these are all diseases that were recorded and which caused a high damage to a number of persons. So these diseases include West Nile virus, cryptosporidiosis, Ebola virus, diphtheria, drug-resistant malaria, typhoid, human monkeypox, Zika virus, Ebola virus, dengue, Zika, H1N1 influenza. So these are all diseases that are very harmful, and they are categorized into emerging and re-emerging. So first we'll study about COVID-19. COVID-19 is a contagious disease caused by virus, also called as SARS-CoV-2. The first case was identified in Wuhan, China in December 2019. The disease quickly spread worldwide, resulting in COVID-19 pandemic. The symptoms included fever, cough, headache, fatigue, breathing difficulties, loss of smell, loss of taste. The symptoms began 1 to 14 days after exposure to the virus. At least a third of people who were infected did not develop noticeable symptoms. So those were subclinical cases. The older people were at higher risk. They are at higher risk of developing severe symptoms, for especially those with other diseases like cardiovascular diseases or respiratory diseases. So the chance of getting COVID-19 and with severe effects is high. Some people continue to experience a range of effects for months or years. This is called as long COVID. And damage to organs have been observed. For example, some people did not report 100% reverse in sense of smell or sense of taste. So that would be categorized as long COVID. Multi-year studies are underway to further investigate the long-term effects of the disease. So the COVID-19 vaccines have been approved and distributed in various countries, which have been initiated mass vaccination campaigns. The other preventive measures include physical or social distancing, quarantine, ventilation of indoor spaces, use of face masks, coverings in public, hand washing, keeping unwashed hands away from face. Next is HIV. HIV was unknown until 1983 and was initially discovered in homosexuals. Now 2.3 million cases occur yearly. It is a virus that attacks cells that help the body fight infection, making a person vulnerable to other infection and disease. It is spread by contact with certain bodily fluids of person with HIV, most commonly during unprotected sexual intercourse. And also it is spread through sharing injection drug equipment. AIDS is the last stage of HIV infection that occurs when the body immune system is badly damaged because of the virus. Without the antiretroviral therapy, the person may develop AIDS and will experience many symptoms associated with condition. Mother to child transmission, vertical transmission can occur antepartum, intrapartum, or postpartum. Postpartum, it can happen via breastfeeding. Avoidance of breastfeeding has been suggested to reduce the risk of HIV transmission. However, in resource-poor settings, Breast milk substitutes may be difficult to obtain, and benefits may be offset by increased respiratory and gastrointestinal infection and non-breastfed infection. Exclusive breastfeeding carries a low risk of HIV transmission than mixed feeding in South Africa and in developing countries. Then what is AIDS? HIV is a virus that may cause an infection. AIDS is a condition which is short for acquired immunodeficiency syndrome. Contracting HIV can lead to development of AIDS. It is also stage 3 HIV. A person with HIV is considered to have progressed to AIDS when the number of CD4 cells fall below 200 cells per cube millimeter of blood. In a healthy person, the CD4 counts are between 500 to 1600 cells per millimeter cube. And the person develop opportunistic infections regardless of CD4 count. And an HIV infection does not necessarily progress to stage 3. And in fact, many people with HIV live for years without developing AIDS. Another factor that signals that stage 3 HIV has developed is presence of opportunistic infections, which are caused by specific virus, fungi, or bacteria that would not make a person with an undamaged immune system sick. With today's treatment for HIV infection, people can live with HIV and never have AIDS. It is also important to note that successful antiretroviral treatment in sustained undetectable viral load prevents the risk of transmitting virus to the partner. Pakistan witnessed several outbreaks in last few years, namely in Larkana, in which WHO declared a Grade 2 emergency. A Grade 2 emergency is multiple or single country emergency that requires moderate response by World Health Organization. The World Health Organization identified iatrogenic tools such as male circumcision tools, they use needle and unsafe blood transfusion as a factor for spreading of AIDS. So this is the chart of HIV in which CD4 count is correlated with the clinical infections and clinical presentations. So in greater than 500, community-acquired organism is reported. In 200 to 500, CD4 count TB is reported. Less than 200, opportunistic infections result. Less than 100, toxoplasmosis in Canada. Less than 50, cytomegalovirus, streptococcus. Then there is Ebola. Ebola is a breed of deadly hemorrhagic fever of most notorious disease which has struck Africa. First time it struck in 1976. Recent epidemic in Guinea, and then it spread to South Africa. More than 25,000 cases with 1,000 deaths, with 10,000 deaths, high fatality rate, incubation period of 2 to 21 days, and is not infected during this period. Asymptomatic cases, it is asymptomatic during incubation. Incubation is period is the time period from exposure to infectious agent when we actually develop symptoms. It is transmitted through direct contact with blood, organs, body secretions, or bodily fluids of infected animals. Human to human contacts is through bodily fluid, blood, or infected person, or through exposure to objects such as contaminated needles. It is not transmitted through air, water, or food, characterized by sudden onset of fever, intense weakness, muscle pain, headaches, sore throat, vomiting, diarrhea, rash, impaired kidney, and in some cases external and internal bleeding. Currently, there is no specific treatment for this disease. Recently, there has been vaccine approved by United States and European Union, and the only care that was offered is supportive care. So you can see that it causes a plethora of symptoms. It kills between 25 and 90% of symptoms. Then there are epidemics of foodborne and waterborne diseases. The epidemics of foodborne and waterborne diseases, such as bacteria, E. coli, O157, colon H7, reported in 1982, and has since been implicated in many serious outbreaks of diarrheal diseases, sometimes leading to even kidney failure. Transmission is via fecal-oral route, and most illness has been through distribution of contaminated raw leaf, green vegetables, undercooked meat, and raw milk. So this is strain causes, which is gram-negative, causes severe acute hemorrhagic diarrhea, dysentery. Although non-hemorrhagic diarrhea is also possible. Usually little or no fever is present. Abdominal cramps are also reported, and illness resolves in 5 to 10 days. It can also be asymptomatic. It can be avoided by consumption of unsafe dairy products, like avoiding unpasteurized dairy products, undercooked beef, unclean vegetables, and unclean water. avoidance. It reduces the risk of E. coli infection. Then hand washing. Hand washing is the single most important tool for prevention of these diseases. Hand washing with water has been treated with adequate levels of chlorine or other effective disinfectant after using toilets or changing diapers, especially among children. Those with diarrhea reduces the risk of transmission. Then hand washing in the education in the community, people need to be counseled and they need to be told about the benefits of hand washing. It reduces diarrheal and illness with weaker immune system by 58% and in normal person with 23 to 40%. Then cholera, the completely new strain. What are new strains in which there is a genetic mutation and there is resistance development to existing antibiotics. So that is new strains are there in bacteria and pathogens both. So the new strains of cholera appeared in India in 1992. That was 0139, and then it is spread to northwest and other areas of India and into western China and other parts of Southeast Asia. So the cholera outbreaks are more common after floods and earthquakes because natural disaster often damage sanitation infrastructure. Water treatment and sewage treatment plants are often overrun during flood, causing wastewater and drinking water to mix. So, for example, when the recent floods came in Pakistan, there were increased reports of cholera outbreaks. That was due to damage to existing infrastructure in which wastewater and drinking water was mixed. So this is a research which was done, which showed that there was a cholera spike following monsoon floods in Pakistan. Then influenza. The threat of new global influenza is increasing. The major shifts in makeup of virus occurs after every 2 decades, triggering large epidemics in many parts of the world, causing thousands of deaths. There is an influenza exchange of genetic material between these viruses, producing new strains leading to epidemics of human influenza, each due to different strains. Currently, H5N1 avian influenza strain has pandemic potential. In 2002, a new disease called SARS was reported from China with rapid spread to Singapore, Vietnam, and Taiwan. That outbreak was caused by severe acute respiratory syndrome coronavirus, infected over 8,000 people from 30 countries, and resulted in at least 774 deaths. And more recently, the pandemic due to influenza H1N1 is continuing worldwide, and it has included 214 countries, taking more than 18,000 lives. The new strains of cholera and influenza affect all age groups. Then there are re-emerging diseases. These refer to diseases which are easily controlled by chemotherapy and antibiotics, but now they have developed antimicrobial resistance and are appearing in epidemic form. The increasing use of antimicrobials worldwide in subtherapeutic doses and sometimes in counterfeit forms indicate this problem will increase in foreseeable future. For example, we see even in Pakistan that these antibiotics are easily available at pharmacies and people take it in without any recommendation, and due to this the new strains are developed and the pathogens develop resistance to bacteria develop resistance to these antibiotics. So the changes in living style, behavior, and drug use and cultural and social issues are behind emergence of infections such as syphilis. Increase in number of sexual partners have been main factor in the spread of sexually transmissible disease. Travel, including tourism, also play a role. The spread of syphilis in 18th and 19th centuries was related to movement of armies. So human mobility is important for spread of disease. Re-emerging diseases continue are also due to spread of viral hepatitis related to techniques such as kidney dialysis and multiple blood transfusion. Okay, so when someone donates a blood to an organization which provide these services, the blood is screened for hepatitis, for HIV, for syphilis, for malaria. So when this is called safe screening practices, and if these safe screening practices not done, then there is high chance of these diseases getting transmitted to recipient who is receiving the blood, who is for any purposes during surgery or due to anemia. So hepatitis, the relaxation in immunization can lead to resurgence of diseases due to war zone. Hepatitis B infected patient need to be isolated in a separate room and hemodialysis treatment should be performed on dedicated machine. So when a person who has hepatitis B or HIV undergoes dialysis, there is a separate machine available for those due to due to high contact. So, but if due to availability due to strain on financial resources, this practice is not followed, then there is high chance of transmission of hepatitis B and HIV to non-infected persons. Then new animal diseases also pose potential foodborne risk to human health. For example, bovine spongiform encephalopathy. Infectious diseases agent responsible may be passed through food chain to cause Creutzfeldt-Jakob disease in human which brain is attacked. It is responsible for new diseases. The increased contact between humans and animals due to urbanization or due to domestication has resulted in these diseases. So what are the factors that are responsible for emerging and re-emerging diseases? The first and foremost is unplanned and underplanned urbanization. The high migration from rural to urban areas has resulted in collapse of existing infrastructure. Then there is overcrowding and rapid population growth. The world population is increasing at a rapid pace, and something needs to be done to control this population. Then poor sanitation, inadequate public health infrastructure, resistance to antibiotics, increased exposure of human to diseases, vector and reservoir of infection, rapid and intense international travel, global dispersion of diseases, microbial genetic mutation, deterioration in disease surveillance systems. So antimicrobial resistance, what is it? It is resistant by diseases causing organisms to antimicrobial drugs and other agents, and it is a major health problem. It is making a growing number of infections untreatable. It has deadly impact on control of disease such as TB, malaria, cholera, dysentery. It has worsened dramatically in last decade. The pace of new antimicrobial drugs has slowed down while prevalence of resistance have grown at an alarming rate. So a new antimicrobial drug takes almost 10 years from clinical research to come into the market. And due to the misuse of antibiotics, the resistance has developed against existing antibiotics. Major cause of current crisis is uncontrolled and inappropriate use of antibiotic drugs in both industrialized and developing countries. Used by too many people to treat wrong kind of infection, wrong dosage, and wrong period of time. Implications: drug costs millions of dollars to produce and 10 years to reach market, so they have a limited time span. As drug resistance spreads, lifespan shrinks, and fewer new drugs appear, gulf widens between infection and control. Overuse of drugs to cover a range of problems is a serious problem. In developing countries, problem is compounded by ready availability of over-the-counter drugs. This allows patients to treat themselves with wrong medicine or inadequate dosage. Substandard and counterfeit drugs are also responsible. In Pakistan, there were more than 59,000 deaths attributable to antimicrobial resistance, and 2,21,300 deaths associated with directly or indirectly. Pakistan has the 176th highest age standardized mortality rate per 100,000 population associated with antimicrobial resistance. So the enterococci contribute to some of the most common infection acquired in hospitals, causing intra-abdominal abscess, endocarditis, and infection of urinary tract and soft tissues. In some countries, infection resulting from resistance to main group of antibiotics such as beta-lactam glycosides can only be treated with vancomycin. Vancomycin is the strongest antimicrobial which you can offer to a patient. Even the resistance to vancomycin is developed. So that is the state that we are in. So the strains of Mycobacterium tuberculosis resistance drugs are widespread. Drug resistance is a result of poor prescription practices, poor patient compliance with treatment. Multi-drug resistance occurs when case becomes virtually incurable, and doctors face situations similar to pre-antibiotic era. Staphylococci, which can contribute to instant infection, endocarditis, food poisoning, have developed resistance to all except vancomycin. If vancomycin resistance were to emerge, some of hospital infections would become untreatable. So there is a DOTS therapy, Mycobacterium tuberculosis treatment, which is directly observed therapy, short course program to help cure tuberculosis. A DOT lay worker meet with client to help with TB medication and provide support and education. It means watching clients swallow each dose of anti-tuberculosis medication. So the drug resistance TB has developed. Multi-drug resistance, extensively drug resistance, and it is caused by incorrect prescription, irregular supply of drug, patient non-adherence, low grade quality of drugs. Then we have malaria. Malaria presents a double resistance problem: resistance to Plasmodium parasites, which cause the disease, to anti-malarial drugs. Resistance of Anopheles mosquitoes to pesticides. Most of them act by killing parasites, which, when they are multiplying in bloodstream or human host. Due to misuse of drugs, resistance has developed. Resistance to chloroquine has been found in all endemic countries. It is common in resistance is common in Southeast Asia, further complicated by resistance to insecticides. Many mosquitoes are resistant to insecticides that are currently available. So how can we prevent emerging and re-emerging disease? First is surveillance and response. Detect, investigate, and monitor emerging pathogens, the objective of which are strengthen infectious surveillance and response, including expansion and creation of programs, networks, and surveillance, improving methods for gathering and evaluating data, ensuring the method of surveillance data to improve public health practices and medical treatment, and strengthen the global capacity. Outbreak prevention. Numerous outbreak prevention have been initiated in the region to address the threat of cholera meningitis. Mass vaccination campaigns should have been conducted in Sudan. Yellow fever and oral cholera vaccination has been introduced in war-torn regions for protection against cholera. A strategic framework was developed for cholera preparedness. Response and technical support was provided to Arab region to develop preparedness and response. Then rapid response. All countries of the region have trained response teams at the national level to investigate and rapidly respond, and at subnational levels for responding to local disease events. For example, in dengue fever in Pakistan, cholera in Yemen and Somalia. Infrastructure and training, strengthening public infrastructure to support surveillance and research, enhance epidemiologic and laboratory capacity, improve central drug control to communicate electrically with state and local health authorities, enhance the nation's capacity to respond to complex infectious disease threats in US and internationally, provide training opportunities in infectious disease epidemiology and diagnostic in US and throughout the world. Improve One Health collaboration. One Health important. It is based on the fact that human health and environment are linked and affect each other. It has been estimated that more than 75% of emerging infections are of zoonotic origin. So, to promote animal and human health by vaccinating poultry and other animals to prevent the spread of infections. One specific example is an elimination of rabies in developed countries due to vaccination of canine population, resulting in a huge cost saving and human benefits. Reforms of WHO of health emergencies. Following the Ebola crisis, the 69th WHO adopted the reform of WHO work in health emergency management, in which officially document was launched to address full risk management cycle, prevention, preparedness, response, and recovery. And the program coordinates responses to contain the disease outbreak and provide effective relief. Then the target area should be antimicrobial resistance, the emergence of drug resistance, parasite, viruses, and bacteria. As the 21st century approaches, many important drug choices for the treatment of chronic infections are increasingly become limited, expensive, and in some cases non-existent. So this is a very important area that needs to be worked on. Foodborne and waterborne disease, changing in way food is processed and distributed. In addition, new group of waterborne pathogens have emerged that is unaffected by routine disinfection. Vector-borne and zoonotic diseases. Many emerging or re-emerging diseases are acquired from animals or transmitted by arthropods. Environmental changes can affect the incidence of these diseases by altering the habitats of these vectors. Then target areas, safe blood screening practices should be practiced. Improvement in blood donor screening, serologic testing, and transfusion practices. And then lastly, vaccine development and use. Diseases of travelers, immigrants, and refugees. Persons who cross international boundaries, tourist workers, immigrants, and refugees are at increased risk for contracting infectious diseases, and they can disseminate diseases to new places. For example, a person who is from South America if he or she travels internationally, carries the risk of transmitting that disease to a country that does not have the disease. So the person needs to be vaccinated against that disease and needs to be screened and, if necessary, quarantined for that disease. Thank you. That's all.